Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. I'm going to be speaking with Dr. Ernest J. Grant this morning, president of the American Nurses Association. He's joining us on the program to talk about the COVID-19 HCP vaccine education effort. That's a partnership with the Ad Council and the COVID Collaborative. Welcome to Health Professional Radio, Dr. Grant.
Thank you for having me. Delighted to be here.
Well, president of the American Nurses Association, give us a bit of your background and talk briefly about your role as president of the association.
I represent the nation's 4.3 million registered nurses. It's a very tough job, and somebody's got to do it. Yeah. We help to set policy and practice regulation guidelines and et cetera for the nation's registered nurses, and also advocate for health on behalf of the public also.
Was nursing your first love as far as healthcare is concerned?
Yes, it was. I originally, out of high school, I wanted to go to medical school, but was persuaded to go into nursing and never looked back. Actually, I truly believe that this was my calling.
Give us a little bit of background about the Ad Council's Healthcare Professional video series. Talk about the purpose of this video series as you understand it and why you and the association decided to get involved.
Well, the Ad Council video series is, our goal is to ensure that the American public has the most accurate and up-to-date information possible about the COVID-19 vaccines, and how they can go about getting that and et cetera. And of course, the American Nurses Association, it's only right that we would be involved, given that, one, nurses are the most trusted profession by the public. Two, we are there with the people or patients 24/7. And of course, it is, as I mentioned previously, advocating for the public's health is one of the things that the American Nurses Association does as well.
Let's talk about some of the specific topics that the video series addresses.
Well, some of the things that it addresses, obviously, is to talk about the type of vaccines. Both of the vaccines that are on the market are mRNA vaccines, and sometimes when people hear the word vaccine, they may think of the fact that it may have a live virus or an attenuated virus, and that is not the case in these types of vaccines that are available. They're totally different. So there's no way that a person could get COVID-19 from these vaccines. The other thing that, some of the things that are covered as well is what to expect when you are getting your injections, both, the differences between the first injection, where you may have a little bit of a sore arm and et cetera, and with the second or the booster shot, where then you may experience, fatigue, the sore arm, maybe a fever, maybe chills, for a few hours, but that is, is expected to go away. And then I guess a third point is to emphasize that the vaccines are free, because the government paid for these, with taxpayer dollars. So therefore, they are free. However, in some cases, there may be an administrative fee for insurance companies. So sometimes people may ask for their insurance card, and that is because there is an administrative fee that they may use for the insurance companies. But 95 to 99%, it should be free.
You mentioned a high degree of trust among patients for nurses. The questions that people have about the vaccine are going to differ. They're going to differ from patient to patient and from healthcare professional to healthcare professional. How can nurses best prepare to address the patient questions about COVID-19 that they're going to get inevitably?
Well, one of the best ways for nurses to be prepared is to educate themselves. One of the things that we are finding is that sometimes they themselves may not be familiar with how the mRNA vaccines work. So it is important that nurses are educated about that, and most importantly, that they get their information from a trusted source. Something like the CDC or perhaps the American Nurses Association website, or maybe another healthcare provider. So that they can answer the questions and concerns that the patients may have as well. So, so we have to start with educating ourselves before we can begin to educate the public.
I understand that there's a lot of borrowing of personnel between counties, in some cases states. Many of the policies and guidelines differ from locale to locale. Have you heard any feedback about maybe some of the solutions that nurses are offering as they encounter different situations across the country?
Yes, I have. And one of the things that we have always advocated for is that nurses need to be at the table where these decisions are being made, because, again, who knows the community better than nurses? So, one of the things that we could do is to help, spotlight along the distribution chain or supply chain, where, shortages may occur and why, or, try to prevent that from happening, by saying, by being at the table and knowing if we're going to go into this area, there may not be enough resources there. So if we're going to go there, we need to make sure we have extra resources and et cetera, to make sure that everyone is covered, as opposed to going there and finding that out. So it's crucial that nurses are at the table so that they can provide that valuable input.
As the questions that nurses have about the vaccine are going to vary greatly from the questions that patients have, is there a situation where too much information for the patient?
I would hope not. One of the things that a nurse has to do, as I stated, educate themselves, but then be able to break it down to common language, I guess you could say, that the individual may be able to understand. One of the things we want to definitely make sure is that the person is fully aware and fully educated about the vaccine, so that there's no hesitancy when it comes to taking that. So I really don't think that there's too much information that anyone could get. It's a matter of it's broken down to where they can understand it, in plain English, so to speak. In healthcare, we do have our own lingo, so sometimes we have a tendency to go away, get away with that. But we need to, explain it as if you're explaining it to your parents or your grandparents, and particularly people where English may not be their primary language. That too takes a very special effort, a concerted effort to make sure that they fully understand as well.
Now, I understand that you were personally involved in the COVID-19 vaccine clinical trial. What compelled you to do that, and how do you share that experience with your patients?
Well, I was involved for two reasons. One, I realized that there was a need for more Black and brown participants in the trial, and so I wanted to be able to do that to contribute to the data or the efficacy effects of the vaccine. And then the other reason that I did it was, as the leader, as I mentioned, of the nation's 4.3 million registered nurses, I wanted to do something that would put me in solidarity with those who were on the front line. And so that once the vaccines were approved, nurses would not have any hesitancy by recognizing that, their leader, participated in the clinical trial and, did not have any side effects or, anything like that. So they would be more reticent, or less reticent, I should say, to take the vaccine, by seeing that, one of their own had gone and done that beforehand. And I think, it has proven to be very beneficial for me because, one, I can use my experience, when I am, and this is something that nurses can do as well, is use your personal experience with having taken the vaccines to also help individuals know. Sometimes if people knew that, the only thing that happened to me after the second dose was I had a little bit of fatigue and I had chills, but I was still able to work, and was not incapacitated for any long period of time. So I think once people hear that as well, that helps to ease the tensions that they may have.
Doctor, where can listeners go and get some more information and, of course, to view the Ad Council video series?
Well, they can view the video from the Ad Council's YouTube page, and they can also visit cdc.gov and search for toolkits for healthcare providers for more resources. And that's a great place for them to get that information.
It's been a pleasure speaking with you, Dr. Grant. I appreciate you taking the time, and thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ernest J. Grant, President of the American Nurses Association. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download a SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.